Continue with major provisions of the PPACA. Title V. Title V has to do with the healthcare workforce. This provision of the PPACA allows for the allocation of resources for the development of education of individuals seeking healthcare careers in the healthcare field. This means that the healthcare center could receive federal funding for allied health professionals. This could be true if the center provides internships and educational opportunities to the students seeking these opportunities. So what is an ACO? ACO stands for Accountable Care Organization. And these are groups of doctors, hospitals, and other care providers who come together to give coordinated, high-quality care to their Medicare patients. The term Accountable Care Organization was first used by Elliot Fisher back in 2006. The term was included in the Federal Patient Care Protection and Affordable Care Act back when it came into play. ACOs resemble HMOs. Now, why were ACOs established? Lawmakers are always looking for ways to cut national deficit. Well, Medicare, as we know, comes with high tax-paying dollars, and it became a prime target. This law created the Medicare Shared Savings Program, and in this law, ACOs make providers accountable for the health of their patients. In fact, they even provide incentives to cooperate and save money on unnecessary procedures with their patients. Now, what are the goals of ACOs, you may ask? And the goal of having an accountable care organization is to improve the quality of life of the patient. So ACOs ensure that patients, especially those who are chronically ill, get the care they deserve while avoiding unnecessary duplication of services and also preventing medical errors as much as possible. This will also allow for healthcare dollars to be spent wisely, allowing to be shared in the Medicare savings programs. Now, speaking on PCMH community healthcare centers in the future, ACOs will help improve the quality for Medicare patients. ACO will be held accountable for providing comprehensive healthcare services to populations. ACO implementation allows for better access to care for the vulnerable populations, and it promotes integrative and comprehensive care as well as better care coordination by prioritizing Medicare patients. Now, on behalf of C.W. Williams Healthcare Centers, it provides primary and preventative health services. With the implementation of ACOs, it will also be able to avoid unnecessary tests and procedures, leading to savings in the managed Medicare savings programs. Continuing on with the future of PCMH community health centers. By implementing ACOs, it may allow an increase in income, and according to the case study, after implementing a managed care plan, C.W. Williams was becoming financially strong. They have since then reported that the care received an increasing amount of money and federal grant money for the first 10 years of operation as the number of their patients grew and increased. Implementation of ACO provides incentives and helps save the center money on unnecessary medical procedures. Now, contractual options. Traditionally, the patients of C.W. Williams Healthcare Center that needed hospitalization were admitted to Charlotte Memorial Hospital, one of the 5 designated by the state of North Carolina to handle major trauma cases, as well as perform research in the area of trauma. The center was strongly linked to the Charlotte community, and it worked with other public and private health services to coordinate resources for effective patient care. Charlotte Memorial became Carolina's Medical Center, also known as CMC, when it began a program to develop an integrated system. Continuing on contractual options. C.W. Williams provided Carolina Medical Center with more than 3,000 patient beds. The patients were usually seen by their regular C.W. Williams physicians. As Carolina Medical Center purchased physician practices and purchased or managed many of the surrounding community hospitals, some of the C.W. Williams patients became concerned that Carolina Medical Center would take over C.W. Williams and that their community health center would no longer exist. Now, continuing on with the contractual options, the C.W. Williams Center recently received information that reported that the 12 largest hospitals in the state, including the teaching hospitals, which included Duke, the University of North Carolina at Chapel Hill, Carolina's Medical Center, and East Carolina, have informed a consortium and will contract with the state to pay for Medicaid patients. At the same time, all of the 20 health centers in the state, including C.W. Williams, are cooperating by developing a health maintenance organization. Since then, 60% of the patients are Medicaid. If the state contracts with the new consultorium, then C.W. Williams will be required to send its patients to Carolina Medical Center. Healthcare connections. The state of North Carolina wanted to move 42,000 Mecklenburg County Medicaid recipients into managed care. The state contracted with six healthcare plans and C.W. Williams as a federally qualified health center to serve with Mecklenburg County Medicaid population. Now, C.W. Williams Healthcare Center affiliations are some of which of the following: Carolina Medical Center, University Hospital, Mercy South, Union Regional Medical, Kings Mountain Hospital or Presbyterian Hospital, Matthews, Presbyterian Orthopedic, and Presbyterian Specialty Hospital. Anti-kickback and Stark Law implications. The C.W. Williams Health Center faces many threats that can hinder its success in the near future, such as uncertain financial future of healthcare in general, healthcare reform, competition and other healthcare providers for the medically underserved, loss of patients as they choose HMOs rather than C.W. Williams managed care reimbursement restructuring, and shortage of healthcare professionals. Wow, that's a lot. Due to the previously mentioned threats that the facility faces, violation of the anti-kickback statute and Stark Law is a huge possibility, mainly because of all the competition that will develop as a result. It is very likely that the healthcare center could participate in things such as paying, soliciting, or receiving anything of value from other companies to induce or reward referrals or generate business. It is also very likely that physicians might partake in referring physicians to entities in which they have financial relationships with. Questions. What was the goal of the C.W. Williams Community Health Center? They wanted to focus on promoting a healthier future for the community by consistently providing excellent, accessible healthcare with pride, compassion, and respect. What was an issue that could be overcome and dealt by with patients? Those who did not have transportation to the clinic could be provided with a service that would get them there to receive their health care. What kind of people face difficulties with obtaining health care? Those who lived in rural areas where there were few medical resources available to them, and those living in economically depressed areas where they lacked health insurance and lived in property were those who faced difficulties with obtaining health care.